Earlier this week, the Environmental Protection Agency began the termination of hundreds of staffers through a reduction of force process, as they're calling it. The layoffs come after the agency announced a massive rollback of environmental regulations last month, including key elements of the Clean Air Act, regulations for pollution from vehicles and power plants, and water pollution limits. The rollbacks are ringing alarm bells for health experts and scientists who say they could cause a serious risk to public health. Let's bring in NBC News medical correspondent Dr. Vin Gupta. Dr. Gupta, always great to see you. So as you kind of comb through some of these rollbacks, what do you view as the impacts to people who live in areas affected by water pollution and air pollution, for example?
You know, Willie, we've lived in a remarkably healthy time in life over the last 2 decades, where we've had some of the cleanest air we've seen, our country has seen over the last, century. It's been the last 20 years. And what the Trump administration is doing is putting all of that progress at risk. The Clean Air Act, people don't talk a lot about it, Willie, but the Clean Air Act is probably one of the greatest forms of legislation we've seen of any type, whether it's healthcare related or not, in terms of its impact. It's dramatically improved air quality across the country. I mean, growing up in smog, for those that were born in the 1950s and 60s, you know what I'm talking about in terms of what you had to live through every single day. That doesn't exist today, but these EPA rollbacks are putting that at risk. The American Lung Association just announced over 156 million adult Americans live in areas of poor air quality. And Willie, what we know is that this is not some sort of abstract health risk. This is actually an independent risk factor for early death and disability. It's a second leading risk factor for death now worldwide. So this is a big deal.
Dr. Gupta, you were just talking about, we've been talking about air pollution in this country and worrying about air pollution in this country since the early 1960s, especially in Southern California and places like that. That's where the worry began and continues. But what you just mentioned is, to me, shocking and surprising, that air pollution now, according to some estimates, is the second leading cause of death globally. That is amazing to me.
Yeah, you know, Mike, I mean, the thing is, this is something that we've just now realized over the last few years. And obviously, the Lee Zeldin-Trump EPA is going to worsen this by rolling back limitations on soot pollution from smokestacks, from car emissions, reducing incentives for EVs. I mean, these policies were put in place for a reason. It's because we're recognizing in places like China, in places like India, deep impacts between breathing in unhealthy air and what that's actually meaning for our lungs, our heart, our brain. We know that there's early links to dementia, risk of underlying lung disease. You can develop heart disease if you're chronically exposed to air pollution. And oh, by the way, here in the United States, whether you're in New Jersey, which you're all of you right now, unfortunately, are breathing in poor air based on what's happening in New Jersey, whether you're here on the West Coast, where we're always at risk of wildfire smoke, whether it's wildfires or just chronic air pollution, this is the issue of our time. And the rollbacks here are going to have detrimental impacts, not just for all of us, but for generations to come.
Dr. Gupta, Claire McCaskill has one for you. Claire?
Good morning, Doctor. Speaking of our health, I think this administration is attacking our health on so many fronts, but I particularly am interested in what they're doing to medical research in this country. I don't think most Americans realize to what extent the federal government has supercharged medical research in this country through funding to higher education and the National Institute of Health, NIH. Can you speak to what debilitating impact our health will have on our health as this administration basically takes a wrecking ball to medical research?
Well, Senator, I'm so glad you brought that up, because you're right. I don't think we talk about this nearly enough. And so for all your viewers out there, just to realize, we're always talking about these new miracle weight loss drugs, Wegovy, Ozempic, you name it. Now oral versions coming out soon, which is a good news. The foundational research into these weight loss drugs was taxpayer funded by the American taxpayer back in the early 2000s. The foundational research, back when no pharmaceutical company, Claire, cared a lick about this category of drugs. They didn't think they'd make a profit at all 20, 25 years ago. And who stepped in to say, maybe something interesting is here, we should explore it? the American taxpayer through the NIH. And now here we have these game-changing drugs. We're seeing the same thing with Alzheimer's treatments now being put on hold because there's dose-related cuts, and now that we can't advance critical Alzheimer's treatments that for the first time in decades are finally showing some actual relief, treating the underlying condition. New chemotherapeutic agents also being put on hold. These clinical trials take time. To your point, there's a long-term view here. These things don't happen overnight. You need decades of willingness from the US government to bring about these medical miracles. Without them, we're now going to see, just to give you a number here, between 2013 and 2020, 100% of the hundreds of new therapeutics brought to market by the FDA approved, 100% of them received NIH funding. So in 5 to 10 years, if not sooner, us doctors will have less in the way of tools in our toolkit to treat all of the patients across the country. That's going to impact everybody, whether you're a Democrat or Republican.
NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, we always appreciate it. Thanks so much.